Every year, approximately 40,000 cases of Salmonella are reported in the United States alone.
Salmonellosis is a bacterial disease caused by the bacterium Salmonella. Many different kinds of Salmonella can make people sick. Salmonella is generally more common in the summer than winter.
Because many moderate cases are not diagnosed or reported, the actual number of infections may be up to 30 times greater.
Most people infected with Salmonella will develop fever, diarrhea, and stomach pain 12 to 72 hours after they are infected. Symptoms usually last only 4 to 7 days, and most people recover without treatment.
In some cases, severe illness may occur which requires medical attention and hospitalization.
In these patients, the Salmonella infection can spread from the intestines to the bloodstream and then to other body sites. In this situation, the infection can cause death unless the patient is treated promptly with antibiotics. Salmonella is generally diagnosed by culture of a stool sample. In severe illness, it can sometimes be cultured from other body sources, such as blood.
Usually, people get Salmonella by eating contaminated food.
A few years ago, the CDC began investigating after receiving reports of an unknown illness. In a few days, it had identified pot pies as a potential source of Salmonella that sickened more than 100 people in dozens of states.
Because foods of animal origin may be contaminated with Salmonella, people should not eat raw or undercooked
eggs, poultry, meat, or drink unpasteurized milk. Raw eggs may be unrecognized in some foods, such as homemade hollandaise sauce, homemade salad dressings, tiramisu, homemade ice cream, homemade mayonnaise, cookie dough, and frostings.
It is very important to note that most products contaminated with Salmonella do not taste or look any different than normal. Some may taste bad only because they contain other contaminants.
To keep your food safe, remember: clean, separate, cook, and chill.
Animals can also carry Salmonella and pass it on in their feces. Therefore, people can get Salmonella if they do not wash their hands properly after contact with the feces of animals including
dogs, cats, birds, horses, baby chicks, ducklings, and farm animals. And reptiles, such as lizards, snakes, and turtles, are especially likely to pass Salmonella to people. Always wash your hands with soap and running water after contact with animal feces, after touching reptiles or any objects and surfaces that a reptile has also touched.
Some people are more likely than others to get Salmonella. If you have a compromised immune system, avoid contact with reptiles, baby chicks, and ducklings altogether. Also, be extra cautious when visiting farms and contacting farm animals, including those at petting zoos. People who are more likely to get Salmonella include
infants and children under 5 years old, the elderly, organ transplant patients, people with HIV or AIDS, people receiving treatment for cancer, or anyone with an impaired immune system. A person's age and health status may affect his or her immune system, increasing the chances of getting sick.
Salmonella can be controlled and prevented. For more safety information, visit this website for regular updates.